Hi, I'm Dr. Farrell. Nice to meet you.
Hi, welcome.
Thank you. I'm one of the family medicine residents. I'm here to see Mr. Coleman today, and I understand you're the director of the assisted living facility.
I am.
Really nice to meet you. Thanks for taking time to meet. I'm a member of the geriatrics team at the primary care office, and I understand that he just recently arrived here. I saw him a few months ago at the skilled nursing facility, and it's my understanding that he was discharged after rehabilitating there, was home for a month or two, and then was having some difficulty managing his medications, and so now he's here. But before I talk too much about Mr. Coleman, I haven't been to an assisted living facility before. I'm not too familiar with assisted living facilities, and I'm used to seeing patients at skilled nursing facilities. So I'm just wondering if you could tell me a little bit about what it's like for patients to live here.
Happy to.
Okay.
Thank you. First, we refer to those who live here in our assisted living facility as residents, not patients. We try to have a more home-like setting in an assisted living facility than a nursing home has the ability to. And also, our residents are often more independent than those who would be living in a nursing home can be. Another major difference is that my staff is a non-medical staff, and we have a little less staff-to-resident ratio than a nursing home would have. We would develop an individualized service plan and help a person with whatever they might need. Some of our residents might need help with putting on their shoes. Others might need help with their medications, preparing meals, laundry, housekeeping, and transportation to medical appointments when their physicians are not able to come and see them here in the home setting.
Is this expensive for the residents here?
It can be expensive. This industry is funded by private pay, so out-of-pocket expenses. There is not governmental help for funding in the assisted living industry.
I see. Okay. And so are there activities available for the residents? I know in nursing homes, for example, there are activities that they'll have, and they'll have opportunities to go to other locations. Is that sort of thing provided at the assisted living as well?
Absolutely. We have less structure here, but we have absolutely activities each day. We try to help our residents get up and move and exercise.
Speaking of socialization, it sounds like one of the things we hope is that Mr. Coleman's transition here has gone well. How is he getting along? Is he meeting other residents here? How's that going?
He's doing fairly well. Our residents often take a little time to adjust to living here in an assisted living facility. I think he really enjoys having the medications managed by our staff, but he's isolating himself during meals and activities, which we need to address and see how we might be able to help him.
Well, that's really helpful to know. It's something I'll keep in mind when I see him today. So it was nice to meet you, Marcia, and thanks for filling me in on what goes on here. And I'll plan to see Mr. Coleman and then check in afterwards.
Excellent.
Okay, thanks.
Thank you.
Thanks for your time.
Thank you.
Mr. Coleman? It's one of the doctors here. Hey, it's one of the doctors here.
Oh, yeah, sure, I remember you from the nursing home.
Yeah, we met a few months ago.
Yeah, you came in and visited me there.
Yeah, I'd like to do a home visit today. Is that okay?
Absolutely. Come on in.
Okay, hey,
yeah.
thank you very much.
Glad to see you.
Hey, nice to see you too.
Look at the difference between what you saw over at the nursing home.
That's very nice.
So they got a little kitchen
Little
here.
kitchen there.
Yeah, they got a bathroom and a big TV, flat screen.
Yeah,
Yeah,
pretty nice setup here. Hey,
yeah.
pretty nice setup. Thanks.
Well, it's nice of you to come.
Thank you. Hey, it's good to be here.
What brings you here?
Well, I'm part of the senior clinic team, and you might remember that we saw you before you were residing in the skilled nursing facility.
Right.
And it's
But I
been.
was at my old apartment.
That's right. It's been a few months since you've been out of the skilled nursing facility, and I wanted just to really kind of bring your medical care to you rather than having to have you come to the office. So
Yeah,
it's a
because
home
we
visit.
have, I think we have an appointment in a couple of weeks.
Yeah, and we do sort of a mix of both. So from time to time, we like to come to people's homes and see how they're doing.
Oh, okay.
If
That's
and so
The cardiologist?
Yeah, have those been scheduled?
I know I have one in a couple. Melanie has, my daughter has all that stuff from the nursing home, and she keeps the paperwork.
And who are you scheduled with back at our office when you return to our senior clinic?
I don't know.
Okay, we'll make sure we figure that out today.
Okay.
Okay.
And write it down because,
Sure.
again, my memory is.
I'll be happy to.
Okay, thank you.
So, Mr. Coleman, I'd like to ask you about your transition from living with Melanie and her family to
I
here.
wish you would call me John.
John, okay.
All right, thank you.
Sure. John, how have things been going at the assisted living?
I stay alone a lot. As a newcomer, you're always, an outsider, and then until they get to know you and something like that. But I'm having a tough time. I did meet a lady here who's been very nice to me, and she's invited me for coffee and stuff like that in her place, and that's nice. I like that, and I guess it's going to take time.
So tell me about your discussion with your family. Were you all on board with the decision to come here?
Well, Melanie is the center of it. I mean, she loves me, and I think she feels that she's letting me down. But, having another person live in your home and that throws off the schedule and the kids, It's okay that I'm here. I really am. It's really okay. But I guess I miss the past.
Maybe the most important question for you, John, is how's the food?
It's not great. It's institutional food.
Yeah.
I gotta say though, their ramen noodles are very good.
Are you still partaking in those? Okay.
No, I don't want my feet to swell up.
Okay, that's good. Well, John, I'd just like to ask you some questions about how you've been feeling.
Sure.
And after that, we'll do a brief exam. So, anything like dizziness or lightheadedness recently?
Last Friday night, I was going in after eating, and I was coming back, and I had to stop like 3 times because of my breath was so. And I really didn't know what to do. I was going to call 911 because at one point it got where I thought I was really going to, pass out or something like that.
Boy.
And then anyway, it passed, and I didn't
Okay.
actually call.
Well, why don't we go ahead and check your blood pressure standing up. Go ahead and have a seat. Was a little bit lower that time, and a little concerned that you might not be keeping up with your fluids. Maybe it has to do with some of the food not being quite as appetizing, but it's something we'll want to talk about. So, John, now that you're at the assisted living facility, it sounds like there are services they provide that are similar to what Melanie was maybe trying to do when you were living at her home. What do you think is the most beneficial service that they're providing you with now?
What drove Melanie over the cliff was she was afraid I would take too much medication, or and it's true. I would forget whether I took it sometimes, and then did I take the morning medication when I was supposed to take it at night, and, all that kind of stuff. But here they give it to you. I mean, there's somebody who is gives you exactly what I'm supposed to have when I'm supposed to have it, and so that it just relieves me of that pressure.
So, John, we've talked a little bit. We examined you. It looks like your physical health is pretty good. We'll make some adjustments to your blood pressure medications, and I may also have the staff work with you to check a few more blood pressures, and also maybe check your weight, make sure everything's okay.
What should my blood pressure be? You said it was like 100 or something?
Yeah, and it dropped a little bit lower than that when you stood up. It dropped to about...
Is that a good thing or a bad thing?
Well, I'd like it to be a little higher, in fact. Normally we talk about people's blood pressure being too high, but I am worried that you could fall if your blood pressure is too low. When you stood up, it dropped to about 80 for the top number.
Ooh.
So we'll address that. But I also wanted just to check to see if you had any other concerns or anything that I didn't ask you about today.
A little ashamed of this, but my Social Security, when I first got here, covered the monthly costs, but now they just raised the prices again, and I don't know how I'm going to make up the difference. I mean, I don't have any other income, and I don't want to. And they don't take Medicaid or anything like that. I used to get a grant for older people, but now I can't get it anymore. So that I'm really concerned about that, because where do I go after this? I don't want to go back to that other freaking place.
Oh, the care facility where the.
I mean, they were nice
yeah.
people. I don't get me wrong, but
Yeah.
This is so much nicer.
If it's okay with you, I can discuss that with our team. Our attending physician will be coming later, and we'll have a chance to review that and discuss. And I'll just if it's okay with you, I'll discuss that with the staff here at the assisted living. So, John, I think we're just about wrapping up here. Sounds like we're toward the end of the visit. So,
Sure.
I'm going to go meet with Marcia just to make sure that she's aware of the plan regarding her medications and so forth. Maybe also drinking a little more fluid to get the blood pressure up. But is there anything you want to make sure that I ask her about or make sure that she knows when I go visit her?
Oh yeah, I think tell her that the nightlife here sucks.
Okay. I'll see what I can do. Okay.
Thanks for coming.
Hey, my pleasure. My pleasure. So hey, Marcia, I'm back. I had a chance to meet with Mr. Coleman, and just as you said, it does sound like he's having some difficulty making friendships. Although he has met one of the female residents, and they seem to be hitting it off pretty well. So, is that something that's common to have residents kind of form relationships here? Is that something that is okay with the staff?
Yes, I'm so glad that he mentioned that to you. It is okay, and we do see that kind of a relationship develop from time to time.
Okay. I noticed that looked like John's clothes were fitting a little bit more loosely than I remember, and he also commented that he's more comfortable with the food he was getting at his daughter's house. Could you just tell me a little more about the meals and how that works here?
We are serving our meals in a group setting here, and so we really tried to develop individual plans as much as possible, but that's a challenge for us in this group's meal setting.
Okay. So I examined Mr. Coleman, and his blood pressure was a little bit on the low side. I wonder if he's keeping up with his fluids these days. I'm just wondering, could we check some orthostatics here?
Help me understand what orthostatic is.
Oh, sorry. It's kind of a medical term. It just refers to checking blood pressures in different positions.
Oh.
So would your staff be able to check his blood pressure and then waiting for maybe 5 minutes or so and checking it standing?
We'd be happy to.
Okay.
How often would you need something like that checked?
I'm thinking every day. How do you think that would be possible?
Daily is a challenge for us with our non-medical staff.
Okay. How about every few days? 2 or 3 days?
We would be happy to help with that every few days.
Okay.
And Mr. Coleman, he has his own blood pressure cuff, and he likes to check his own blood pressure.
Okay.
And we'll record what those
Great.
measurements are.
That'd be terrific. Mr. Coleman has heart failure. I think it's important that we check his weights for a couple weeks. Do you think it'd be possible to check the weights every day during that time?
Yes. Mr. Coleman can get on and off the scale, and my staff can help record what those weights are.
Okay, thank you. And let's look at his medication administration record, if we could. Do you have that
I
here?
do. I have it right
Okay.
here. Remember, we're a non-medical facility, and so we don't have access to deep medical records for Mr. Coleman. But I'll share with you some of the discharge plan that Mr. Coleman was sent with from the nursing home, and also a list of his medications and some of the vital statistics that we've gathered.
Okay. I see a discrepancy. It looks like one of the blood pressure medications looks different than what he was taking before, so we need to look into that. I do probably want to cut back on one of his antihypertensives, and I'm wondering, could we go ahead and make that change today?
Absolutely. We can help facilitate that change.
Okay.
It's critical that we clearly communicate that medication needs to be discontinued so that there's not an error in giving him the new medication as well as the old medication.
Oh, has that happened before where people get both? They
Yeah.
get the discontinued dose and the new dose?
It has happened before.
Okay.
We need to be cautious about making sure that mistake doesn't happen.
And so if I want to call a new medicine in the future, who do I call? Where do the medicines come from?
Good question. Remember that we have a non-medical staff here, and so you can't phone in orders to my staff. You'll need to call our pharmacy. I'll give you that phone number.
Okay.
And have the orders be clear with the pharmacy. Then the pharmacy will deliver the medications here, and then my staff will help administer the medication and the appropriate changes to Mr. Coleman.
Great, okay. And one additional thing that Mr. Coleman mentioned to me is that he almost called 911. I'm hopeful that he can avoid going to the hospital. His daughter's not around, so I'm wondering how would he get there?
Great question. Depending on the circumstance, of course, if it's an urgent need, we would help facilitate calling the paramedics and the ambulance to help him be quickly transported to the hospital. If it's less urgent, then we can help get him to the hospital, provide the transportation that he would need to get to the hospital. And then we can also help facilitate the communication to you as his physician to help you understand what is going on with his medical needs.
And do most residents end up seeing their own physicians in the community? Do the community physicians come here? Is it unusual that I'm here seeing him? How does that work?
It is somewhat unusual for home visits, but we'll help facilitate a home visit or a community medical visit. It's important that our residents have access to their medical providers, and we want to encourage that, support that in any way that we can.
If a problem arises overnight, what kind of staffing do the assisted livings have?
We have fewer staff members available at night than a skilled nursing home would have, and my staff are non-medical who can check on Mr. Coleman.
Okay. Well, it sounds like he's having some difficulties adjusting, and we may need to address his blood pressure. So what I'm going to do is see if my attending is on her way. She was supposed to be coming to meet with me and discuss the plan, and also see Mr. Coleman. And we'll formulate our plan and touch base with you once again, probably before we go.
Wonderful. Thank you, Dr. Farrell.
Okay. Thanks, Marcia.
Okay.